Ozempic is a prescription medication primarily used to manage blood sugar levels in adults with type 2 diabetes mellitus. Ozempic is also known by the generic name semaglutide. It belongs to the class of drugs known as glucagon-like peptide 1 receptor agonists. It is also prescribed to reduce the risk of major cardiovascular events, such as heart attack, stroke, or death in adults with type 2 diabetes and established cardiovascular disease. Although primarily used for diabetes, Ozempic can also help in weight loss, which is beneficial for patients struggling with obesity or overweight issues in the context of type 2 diabetes. Common side effects of Ozempic include gastrointestinal issues such as nausea, vomiting, diarrhea, and constipation. Hypoglycemia, particularly when used in combination with other diabetes medications that can lower blood sugar. Injection site reactions such as redness, swelling, or itching at the injection site. Serious side effects include pancreatitis characterized by severe and persistent abdominal pain. Worsening of renal function. There is a risk of thyroid C-cell tumors, including medullary thyroid carcinoma. Severe hypersensitivity reactions, such as anaphylaxis. Ozempic works by mimicking the incretin hormone GLP-1, which is involved in glucose metabolism. Its actions include stimulating insulin secretion in response to meals, helping to lower blood glucose levels, suppressing glucagon release that plays a role in reducing hepatic glucose production, slowing gastric emptying that increase satiety and reduce food intake, which contributes to weight loss. Typically, Ozempic is started at a low dose of 0.25 mg once weekly for the first 4 weeks to reduce gastrointestinal side effects. After the initial period, the dose is increased to 0.5 mg once weekly. Based on glycemic response, it can be further increased to 1 mg once weekly. The maximum dose is 2 mg once weekly. It is administered as a subcutaneous injection in the abdomen, thigh, or upper arm. Ozempic can interact with several medications, including insulin and other antidiabetics that results in increased risk of hypoglycemia. Due to delayed gastric emptying, Ozempic can affect the absorption of oral medications. With warfarin, there is potential for increased bleeding risk. Close monitoring of INR is recommended. Patients with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2 should not use Ozempic. Patients with history of pancreatitis requires caution. Monitor for signs of pancreatitis. Monitor blood sugar levels closely, especially if used with other hypoglycemic agents. Use with caution in patients with renal impairment and monitor renal function periodically. In pregnancy and lactation, it is not recommended due to potential harm to the fetus. Women of childbearing potential should use effective contraception. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.